their parents' siblings or their grandparents, etc., and they don't even know all of their own family history. So this is an opportunity you can take where they can fill the form out together and that they can learn about their family. In addition, some of the parents find out that their child has been having some complaints that they didn't know about.
Yes, right.
When you start asking them specific questions about symptoms and what they've experienced while playing sports.
That's very, very interesting. And the question is it something that you have created from your experience of what you've seen and what you needed to do?
No, the questionnaire actually is, there's 5 different academies that actually came together, wrote a monograph about the pre-participation examination. They put together a questionnaire, and it's pretty widely accepted, and I use that as the one that the 5 major organizations representatives have put together for the recommendation of pre-participation.
You know, seriously, that working in a hospital, working in a critical care area where we have patients who come in and we're trying to obtain history, and one side of the form is the patient himself, herself, and the other part of it is family. And a lot of times too, we see they don't really know, so how that actually could be quite applicable form for everybody, not just, I'd love to see a copy of that.
Oh, well.
That's very interesting. Okay, so now you have 2 offices actually.
Yes.
You function out of the Children's Hospital downtown Detroit.
Correct.
And also the University Health Center. So
Correct.
You're out of the DMC. So tell me about the office at Children's Hospital.
The office at Children's is both offices actually are housed within the orthopedic department. Both of them are focusing on sports medicine. The office at Children's is on the first floor of Children's, just relatively recently remodeled and upgraded so that we have the ability to bring up x-rays and imaging results right in the room, even if we do on that specific day. It's pretty well run, which is nice.
Yeah.
We can service a good number of children and take care of them on a daily basis. A lot of support as far as having 3 other full-time orthopedic surgeons in the office and some other support staff, etc. The kids team, it's a good environment, so the kids team tend to like it. And I've done everything from management of concussions to evaluation of any specific musculoskeletal injury like back, elbow, and shoulder injury to management of like headaches to taking care of kids who have a suspicion or something of being tall for their stature, etc. Anything that has to resolve or revolve around sports, with the exception of the pre-participation physical. We actually have in Children's a specific clinic that we do seasonally around the time that you need your pre-participation physical, which is mandated by the Michigan High School Athletic Association, where we do just those physicals. And we update your immunizations. We look at a little bit of everything at those visits.
That is really, really interesting. And here's the thing that I see, and I used to work at Children's in the 70s, a long time ago. But when you have kids coming into the building, and these are kids looking at sports, so they're old enough to be thinking about a lot of things. They're not just wee little kids. But they walk into the building for an exam of some sort. They see a lot of things that are going on and find it fascinating. See you passionate about what you're doing, and you become a natural mentor for every child with whom you have contact.
There's been a number of the kids that have come in, teenagers particularly, that then elect to do their internships. Some of the high schools in the area have where they're required to do a month in an office, or they're
Yes.
required to do a few exposures in a field that they're interested in. So I've had some patients become observers, and some that have become volunteers,
And don't
and
you
some that have come in and shadowed. They came and became a
Right.
patient, and then they came and decided they wanted to shadow. So that's always kind of fun.
Don't you love it? And don't you find that you're always learning something from them?
Things are changing on a high school level. Yeah, but our youngest I had as young as 4 or 5. Kids are starting earlier and
Oh my
earlier,
gosh.
and
So, like, soccer?
participation
What
in
would they
sport.
be doing at
Some of
that
them are doing
age?
soccer. I have like a 7 or 8-year-old that's doing who's doing skating.
I was going to say skating. Yeah, that would be
Hockey.
it too,
There's
hockey.
young
Yeah.
kids who are doing hockey. There's pee-wee football.
Oh, yeah, that's right.
There's,
Right, that's right. Oh, my gosh.
I had a 5-year-old little girl who's doing cheerleading. You know, you can do all kinds of things.
It must be so fun to just see them coming in, because to them anything is possible. And I found working at Children's, as a comparison to working with adults, that with kids, even if there's something they can't do, they never think about what they can't do. They're always looking out for what they can do. And that enthusiasm, that wide open potential, is something that kids have that we need for us older people, really.
They're more willing to try things, aren't they?
Yeah, they are. They really
We should be
are.
more willing to try things.
Exactly. That's exactly. If you're just tuning in, this is so fun. I'm Liz Aiken. This is In a Heartbeat. I'm talking with Dr. Shelley Street, and we're talking about sports medicine, which is her specialty. And it is so cool that she is board certified pediatrics and adults. And even in the last minute, you can see the enthusiasm of what kids are doing. Anything. It's like a wide open potential world out there. And as you just said, maybe we adults should try more. So now I want to turn it to adults. You are also at University Health Center.
Correct.
And so how different is that when you put on the hat of working with an adult?
Some adults are really rather active. I have some women who are still, some moms that are in leagues, like softball leagues, and that are in volleyball leagues. And then you have some adults that, just injured themselves going up a step or coming down a step or getting out of a car. So the range is pretty, from the most active to the most inactive. One interesting thing is that both the children and adults overall are so much heavier than what they were years ago.
We were talking about that a second ago before we went up, and that line that you hear all the time, we hear all the time, is I have never weighed, and I'd throw myself right in that I'm no better than that. I've never weighed this much in my life. What is the deal? What are you seeing, or what do you think from that when you're seeing that again and again and again?
I hear a lot of adults who will come in and say, yes, I know I have knee pain, I have hip pain, I have ankle pain, and I know I need to lose weight. I weigh over 300 and something pounds.
Wow.
Yes, some of them are pretty overweight,
think of the
or high
strain.
200s. It's absolutely. I'm surprised that you wouldn't be in some kind of pain if you're trying to lug around 300 to 400 pounds. And they're like, I'm trying to lose weight. And I'll ask them, well, what are you doing? And they're like, well, I don't even eat very much. And I said, well, what do you mean you don't eat very much? They're like, well, I don't eat breakfast. I don't eat lunch. I have dinner. And, I'm not hungry when I wake up in the mornings. I really don't eat very much. And I said, well, there's your problem.
Yeah.
Your metabolism is slowing down, and you're telling it, I'm starving. And your body's saying, let me slow down even more.
Right. Let me slow down. Let me start storing it because I'm going to need it.
Correct. And your body always
Wow.
thinks that you need the energy to store it. So some of them have that problem. And others of us are eating things. I know myself, about a year ago, I weighed the most that I ever weighed in life. And I said, well, what am I doing?
Yeah, what is happening? Right.
And you're eating the wrong stuff and not enough of the right things. Not enough fruits and vegetables, way too much
Fast and easy.
fast and easy foods, high concentrated, non-good breads, too much of that kind of food, things you can easily pick up that don't really have as much nutritional content, but fill your stomach and then
Yes.
you know, a few hours later you're hungry again. And I was always someone who was still exercising. No matter what, I was still exercising, but I was gaining weight. And it wasn't until I re-looked at what types of food I'm eating that changed.
And isn't it interesting though, so that when somebody says that to you, you can say, you know, I've been there, done that. Here's what I realized, I really started paying attention.